Hello everyone. Today is a beautiful day and we are here to discuss about some contextual issues. My name is Leah Kuria, clinical expert from Shamiri. We want to dive into the issue of early childhood experiences. This is what we call the ACEs. We want to look at especially the emotional regulation and how can this child or how can this young adult be supported after going through trauma. So we want to ask, what is trauma? And looking at trauma from a very diverse perspective. Trauma is what happens to you that is beyond your control, and this is a significant stressor in your life. Severe illness of a parent, the divorce of a parent, sexual abuse, violence, experiencing an accident, things that you have no control over. And this really disrupts the developing brain and affects the ability of a child to regulate their emotions effectively. And in psychological terms, the child develops attachment issues and struggles with trust and safety, affecting their emotional development. Let's look at an example when a child was growing up and they are constantly, there's violence in the home, there is abuse, there's lack of stability. And this becomes a place where the emotional state of this child is very elevated. They become hypervigilance, and this leads to heightened emotions, and this increases anxiety. They have difficulty in calming down. When they are faced with stressful situations, they are not able to come back to their normal state of emotional being, because remember, they have hypervigilance. And these responses can persist into adulthood and definitely will affect relationships, professional relationships, the way of life of this child. And this is why it is so important to be able to pick trauma and have it assessed and treated, so that even as you grow, you are able to enjoy a holistic life. Over time, we see that childhood trauma can also lead to maladaptive coping mechanisms, such as self-harm. So when you see a child coming in for therapy or to a clinical expert and you see self-harm, that is a behavior that tells you there is an underlying issue. And a lot of times you find there is some level of trauma in this child's life. So when a child is self-harming, for girls, mostly because of their elevated emotional state, because of the natural biological functions of being a woman. And for men, substance abuse. This is how you find a child will get into alcohol, excessive consumption of alcohol that they are not able to regulate. This is where you see they are social drinkers and people who, when they start, just can't stop, simply because this child or this young adult has a predisposition, because there's trauma that was not dealt with. So we find that the emotional regulation becomes something they are struggling with. It makes them unable to cope and build healthy relationships. And you find that they are normal process where when you get annoyed and be able to think rationally, they stay in that anger for such an extended period. So when you're interacting with people out there, when you see these kind of behaviors, instead of stereotyping, this person needs help. So we want to look at how can this childhood trauma, how does it affect the brain, and what can be done? Can we regulate emotional dysregulation? Yes, we can. Yes, we can. Stay with us as we go on and dig deeper into that. So we see childhood trauma can significantly impact the brain. As this brain is developing, particularly the areas that are responsible for emotional regulation. And we are looking at the amygdala and the prefrontal context. And trauma can lead to an overactive amygdala. And once this is active, this person consistently remains in a kind of a flight response. And when the prefrontal cortex, when it is low in terms of response, there is an imbalance, and this results in difficulties in emotional regulations, and like we said, increases sensitivity to stress. So how can we help this person? We want to see, for instance, the individual who has experienced early childhood trauma, they may react more intensely. They always find it so difficult to calm down. Once you trigger them, it's almost impossible to bring them back in the normal time frame that you'd expect anger to calm down. They're overreactive, they have a fear response, and this fear response, unfortunately, manifests as anxiety, and this can lead to anxiety disorder, a mood disorder in adulthood. So their way of responding to life is usually overly above the normal person who has not gone through trauma. We want to see that when this person has gone through all this, when this person has been in this kind of state, maybe they grew up as a child and they went to adolescence, they had coping mechanisms that were not very helpful. Is there anything you can do for them? Once this child is able to meet a professional and they are going into assessment, and you are able to pick that there is anxiety, which probably has brought a mood disorder, which has either brought a depression, then this child needs to have a multi-approach in terms of treatment. Probably there will be need for medication, and as they take medication, they need to go for therapy. So what happens in therapy? Once this person comes into therapy, we will use this kind of a theory called the CBT, the cognitive behavioral therapy. There is also the eye movement desensitization and response, which we call the EMDR. There is also the trauma-focused cognitive behavior therapy. And these are all evidence-based treatments that can help individuals process trauma and learn healthier coping mechanisms. These therapies can assist in retaining the brain's response to stress and emotional stimuli, ultimately improving emotional regulation. And that's our goal, because we cannot undo trauma. We cannot undo what happened, but we can change how the trauma has affected you from the cognitive perspective to help you be able to function from a normal regulation position. When this person is able to be trained to understand that emotions should not overcome you, that you can be able to have a mindful way of thinking, that you are able to get out of that state of negative, heightened emotional response, then it becomes a holistic kind of living. So, what are some of the self-help strategies for managing emotional dysregulation on a day-to-day basis? Now, this person has come. This person has seen a psychiatrist, and they are probably under medication, and they are continuing to go on to their therapy sessions. What are part of those things that they learn? So, overcoming emotional dysregulation often involves a combination of professional therapy and self-help strategies. So there's the bit of the psychiatrist, there's the bit of the psychologist, and there's the bit of the self that you need to do for yourself. Mindfulness-based practices such as meditation and deep breathing exercises can help individuals become more aware of their emotional states and develop greater control over their responses. These practices also foster a sense of calm and reduce anxiety and stress. So, what are we saying in summary of mindfulness? When you find yourself thinking about a negative situation, the big question or the goal is to get well. Is the negative position or thought supporting you? No. Once you pick that it is not supporting you, then you help your brain be able to unlearn the negative tendencies and start learning the positive tendencies that will help you. So mindfulness, that is a summary. Just keep on thinking about the positives that support you, because at the end of the day, we know negative tendencies will not support you. They'll not keep your relationships. They'll not help you at the professional front. They'll not help you even self as a person when you're alone. That rumination of it happened. This is what happened to me. When we cannot change what happened to me, we change the way we look at it. We change the narrative of that. So another effective strategy of helping yourself get through trauma is journaling, so that you are able to track your emotions and identify the patterns. By recognizing your triggers and responses, individuals can learn to anticipate and manage emotional reactions more effectively. Additionally, engaging even in physical exercises which can boost mood and reduce stress, providing a healthy outlet for the emotional release. That's the goal. Being able to release these emotions in a very positive way, in a very positive way to support self, such that you know that my goal is to get all these emotions that have been inside of me out. So when you journal, the journal is a very authentic, safe space for self, because this is you with you. You're able to put all your emotions out there. This makes me sad. This makes me feel hopeless. This makes me feel rejected. When you are able to call an emotion by its name, then that is what we call self-awareness. When you get to a place where I do not know how I am feeling, then your brain doesn't know how to help you. But when you say, I feel sad, I feel that this abuse has caused me to lose so many opportunities because I don't trust people. When you put that in your journal, your brain has already recorded that as being dealt with. So your system is not struggling to keep all that for you. It acknowledges this has been dealt with. So there is space for you to be able to deal with much more. So that journal becomes your safe space. That journal becomes your therapist. That journal becomes your outpouring place. This is where you can be able to say the words in the language that you feel best. This is the space you are able to call things in the language that you feel resonates with you. So make the journal your personal go-to therapist when you're not going to your therapy. And even when you go for therapy, put your thoughts in that therapy in a way that when you look back, you are able to clearly see, I've come from this, but now I am here. Out of 10, I can see I've done a 6, because now your emotions are more clearly defined. Journal, journal, journal. It is the best way to empty self in a safe space. Finally, as we look at the strategies, practice self-compassion. When you're compassionate with yourself, remember you have you. You only have yourself. So when you ruminate and stay in that place of, I am not good enough, I am such a failure, this happened to me because I actually even deserve it. No, nobody deserves to go through this kind of trauma or the type of trauma you went through. Nobody really deserves it. But because you found yourself there, extend compassion to yourself and, bring it in and say, it's unfortunate that I had to go through this. But you know what? I am strong for myself. I am able to overcome this. I am doing my best. What are you extending? You are extending self-compassion to yourself. The world out here might not understand. They might not know how it derailed you. They might not even know the extent of the trauma. They might not even understand how many opportunities that you have lost because you've been in that place of distrust, that place of self-doubt, that space of feeling like you're not good enough. But you can be able to tell yourself, you know what? It's okay. It's fine. It's not the end. There is hope today. There is hope tomorrow. I can overcome. Self-compassion is a very powerful tool. If you use it regularly, it also helps you become calm. Because once your emotional responses align in the brain, then your body naturally responds. So self-compassion, and it's an inexpensive tool. You only need you and put your mind into that state. Self-care is very, very crucial. If you do not take care of yourself when you're going through trauma, you find that you extend your physical body too much. And in that place of extending it, you carry the fatigue. And remember, your body is already carrying fatigue, which is stored in the body in terms of trauma. Setting boundaries, learning to say no. A lot of times you find when you've gone through trauma, you kind of want to be a yes person. You want to please people. You want to be agreeable. And it is okay to be agreeable, but not to the point where it affects your life. Not to the point where you can never balance your life. Remember, you are already in flight mode. So when you're continuously on the go, when do you listen to yourself? When do you take time to sit back and identify the emotions of sad, of unhappy, of abandonment, of rejection? When you can, please say no. I'm sorry, I'm not able to join you today. I will join you next time. What are you doing? You're building your boundaries. As you're building your boundaries, you realize it also builds your self-esteem. It builds your self-confidence. So it's a ripple effect. Enjoying activities that you feel that this really makes me happy. What are you good at? What do you procrastinate in doing? When is the last time you got out of the house and just set this day to do something that makes you happy? Remember the feel-good hormones that come into your being when you are enjoying an activity. And remember, we want to raise our feel-good hormones, our dopamine. We want it to be up so that that state of feeling good comes from a natural place. You don't have to cope by substance abuse, by engaging in activities that don't support you tomorrow. So look for activities that support you. Look for a hobby that when you think about it, you're looking forward to doing it. Seek support. Look for a group that can be able to identify. Look for a group that understands, a group that helps you build your well-being and helps you manage your emotional stability. Develop a network of friends, support groups that provide a safe space, sharing your experiences, learning from others who are faced with similar challenges. So maybe you're there and you're asking yourself, Leah, you have said all these things, and maybe I have a brother, I have a sister, I am a parent, maybe I've seen my children go through this kind of emotional dysregulation. Maybe I went through a divorce and I'm seeing that my children are not responding as they used to. Maybe I've seen my child has been quiet lately and behaving in a way I do not understand. Maybe I need to support them. So how can you support a loved one who has gone through trauma, who is going through emotional dysregulation with patience, with empathy, with understanding? Number one, you validate their feelings and experiences. Remember, this person found themselves in that state. Maybe they had gone out in the night and they were raped. When they left the house, always remember they did not have the mind or the idea that this could happen to them. So understand and extend empathy. And you might not be able to exactly know what it is they went through, but you can be able to just be there to affirm them and say, it must be very difficult. It must be a very difficult period for you. How can I stand with you? When they are reactive, when they are behaving in a way you can't understand, they are banging doors, they are driving on the road and, swerving in the front of other cars and opening the windows and doing things with their hands that are not very good. When you see this kind of behavior, instead of hooting back, probably give them away. Probably you are still in a better state than they are. As a parent, validate this child's feelings. As a young, whoever support system you are in, validate them. Tell them, I may not understand the extent of how you feel, but if you are willing to share, I am here to listen to you. Give them a hug, shake their hand. You don't have to hug them if it's probably against your culture. Just placing your hand on somebody who is going through an emotional dysregulation calms them down. It may look so simple, but the body does respond. So validate their feelings, extend compassion and empathy. Don't minimize. Oh, but how come you're still holding on to that? It's 5 years ago. The body keeps a score. Trauma, unless it is addressed, those emotions do not vanish. They do not evaporate. They get stored in the body and they manifest differently in different triggers, in different situations. So when you see an emotional reaction, if you're a parent, as opposed to returning it with an emotional reaction, step back and look at this child and ask yourself, what are they communicating? If you're in a team and it's in an office, step back and look at this person, because it's probably not about the presentation. It's probably not about maybe they're going to school or not passing the exams. There is more into that reaction. If you miss the opportunity to be able to pick it then you'll be riding on that emotional dysregulation wave with this person that is unending. This is how you'll find abuse has come into a relationship. This is how you'll find a child have been hit by a parent and hurt. This is how you find somebody has gotten fired. Because this starts as a trigger, the emotional wave takes over. By the time you're looking at it, it is way stretched and way gone. So before we get there, let reactions be for you a space to understand deeper what this person is saying. Look at the iceberg. What do we see? A tip. It topples the ship. Why? Because beneath the anchor of that iceberg is so deep. So what tips over a family is those emotional dysregulations. Why? Because the root is deep down there. It is screaming for help. Help me. I am overwhelmed. I cannot cope. I can't go to school. I want an extra beer. I can't do this work. Every time I'm failing to deliver the report. It is so important to read into these behaviors, because behaviors are just a manifestation of the deeper challenge that is within. So trauma, and especially in children, and as parents, we get busy every day, trying to make ends meet. Things happen at home and you're not there, and you come back and you find your child probably they can't give you eye contact, or your child's demeanor is going down, or you're finding this child is more silent. If they are not reactive, they are silent. They are getting into the well, because trauma can respond differently to different personalities, to different stages of life, to different age groups. So when you see that child is going down, they can keep an eye contact. What happened when you're away? As opposed to probably raising your voice and asking them, why are you behaving like that? Look at me. Go into that space. Go become authentic. Validate them. Extend compassion. An example is John. Today you look so down. Is it something you want to talk about? Do you want me to give you a hug? When you're ready, I'm here to listen. You have just extended security. You have just extended compassion. You have just validated this child in that voice and in that tone. And from that, you can be able to pick so much and be able to help that child or that employee or that friend before they tip over. So let behavior manifestations be our place for support, be our place for help. I hope you're still putting for us the questions down there. We are here to answer them. So, in a nutshell, what are we saying about ACEs? That we are not in control over what is going to happen to us, to our children, to our loved ones, to our workmates, but we have the ability to support them, because life will bring different curveballs at different times. But you can be able to be that space for somebody. You can be the one who is able to pull them from the well and say, you know what? I think you need support. You know what? I think what is manifesting clearly is not you. Are you ready to talk about it? A lot of woundedness, a lot of people who even end up committing suicide, had they just had one word that affirmed them, if they had that voice that doesn't condemn them, if they had that one person who they could outpour without being judged, without being blamed, we could reduce a lot on that. So as you walk around, as you see different reactions, what kind of support are you going to be? What kind of a pillar are you going to be? What kind of a voice are you going to be? Our society doesn't depend on probably the leadership. It depends on us, because we are the ones who are able to interact each and every day with each other and be able to see the kind of challenges we are going through and the kind of help that is there. There is so much support when you're ready to get help. I hope this helps a parent. I hope this does help an employee, a friend out there to get out and get support and get helped. You never choose to be where you are, but you can choose to get to where you want to be. Thank you.